everyone. Welcome back to episode number 5. I'm your host, Dr. Esmaili, and I have a great fortune of having one of my amazing friends, patients, and a great soul, Mr. Stephen McKay, here with me. And we're doing another second episode of his journey and how I met him. Stephen has a really great story to tell. If you guys want to learn more about him, reference back to episode number 4, where I actually interviewed him from the beginning of his journey. And we're going to cover where his journey turned into a trip to Colorado and what we actually were able to change in his story. Thank you again, Stephen, to give me another hour to just go over and get down to the deep of your details. I really enjoyed our first episode, and I really enjoyed where you brought your story all the way. And if you want, for those who haven't heard it, just give us a recap so that they know where they're following you.
Thanks for having me. Yeah, so a quick recap would be I had orthodontia in my early years, age 11. Then I had a few injuries and I ended up with neck instability. So I chased after it for a couple of years trying to stabilize my neck. Upper cervical chiropractic adjustments. Then I realized that there was more to the puzzle than what I already knew. So I looked into the cranium and I looked into the rest of the body. I started with the cranium. I found Gerald Smith's website. I ended up in the US. I ended up having cranial adjustments, and then I wasn't 100% satisfied with the results I was getting with occlusal and cranial intervention. So I looked further into the body. And I called that physical therapist down in Texas, and she pointed me to the Postural Restoration Institute, and that's when everything changed for me, whole body integration. So yeah, I think that's where we left off the last time, and to be honest, it's a lot more complex than that, but I'm trying to generalize to speed things up. Yeah,
you go from atlas, the cranium, to the pelvis, and now you found out your body was stuck. You didn't know how to ground yourself, and you didn't know how to move your rib cage and go through gait cycles. And you know all along your mouth has something to do with it. We ended up knowing that for your entire life, perhaps, you didn't know how to be a bipedal animal properly. As we go from 4 to 2, we have a lot of neurological stuff that needs to happen. And our mouth and teeth coming into the equation is a huge part of it. So you had an intuition about it. Then you found out later on that there's in fact a correlation, but you still haven't connected the dots, and you're getting some results from the physical therapist. You're feeling better. Mm-hmm. Yet another part of your puzzle comes together. And when did you start bringing in dentistry and dental orthopedics into this? And what was your journey into that? How did you come into dental orthopedics and find out about all those therapies?
So when I first started doing research on the cranium, I found resources for dental orthopedic appliances that can change your posture and your airway, apparently. And there was a few of these on the market and a few of these to choose from. And I wanted to go with the least invasive one because I realized that my body specifically, didn't want powerful intervention. It wanted gentle intervention that produced powerful results. So I chose the ALF appliance. So throughout my upper neck cranium journey, where I was trying to find out how to stabilize everything, I had an ALF wire installed to my maxilla. And what I noticed with the wire was you can configure the ALF wire to push your cranium into a certain alignment. So if it's off alignment, you can adjust the wire and snap it in, and it changes the alignment of your cranium. And that's when I fully believed that the cranial bones move. How would such thin of a wire adjusted be able to push my face into a different position and change my symptomatology, improve my health? So yeah, that was my first time with the ALF appliance, and my symptoms improved a lot, but I still wasn't happy. I still wasn't as functional as what I used to be, and I still struggled with chronic tension. I ended up having more advanced ALF treatment over in another state with an osteopath guiding the adjustment. So first of all, I had a craniopath guiding the adjustment. Then I changed tactics and I thought, okay, this isn't giving me the results I want, so I'm going to have an osteopath guided adjustment, because the osteopath can feel restrictions in your body and your dural meningeal system and your all types of fascia, organs, bone. They can feel this because they're very sensitive, especially if they've had lots of time with palpation. So I had osteopathic guided ALF expansion, and it went the same way. It wasn't giving me the relief I wanted. And I was getting so frustrated, and I was spending so much time, energy, and resources chasing cranial and airway focused appliances that are guaranteed to change my health. And I just wasn't getting, it just wasn't going over the line, basically. It was getting me relief, but it wasn't fixing the whole problem. And yeah, that was, so the expander was intermingled with the whole cranial upper neck side of things. Then I went to the Postural Restoration Institute, but whenever I realized I wasn't getting better with these appliances, I removed them, and then I didn't need them anymore once I addressed the rest of the body. So I realized then that the body probably was driving most of my oral dysfunction rather than my oral dysfunction or occlusion driving my poor posture.
Because really, malocclusion and teeth are a product of the body. And that's very obvious because the first thing we have is jawbones and skull and pelvis, but we don't have the teeth into the equation. And during our growth and development, from the time we start to roll over as children, become mobile, our sensory and motor information, how we sense the environment and how we respond to it, gait cycles, responding to gravity, all is in alignment and coordination with our teeth eruption. Children, when they crawl, they get the front two teeth, they start crawling, moving their neck. And when they get the molars, they can learn to walk and be in a gait cycle. And that's really important point to know, because if there is, in fact, ill references in the cranium and posture and pelvis, that would reflect in the malocclusion of the teeth from crossbite to underbite to position of the bones. And addressing the teeth, as you said in episode 1, putting straight teeth that are supposed to make you happy can, in fact, not, and do the opposite, because it's not in alignment with the body, because the body is not aligned. So you've just been through so much at this point, but you know where your symptoms are no longer leading, because that's really the goal, is to get homeostasis. And you're not chasing, just get me a relief now. You want to feel better, you know. And so you're still knowing that your mouth has something to do with it, and you've tried several different therapies. I just want to know more about when you went into next level, which was at some point had some rapid expanders placed in. Who suggested that, and why did you seek that treatment, Stephen?
So I had rapid palatal expansion in 2021. I say I had it for a week, and then I demanded that it was pulled out because it was causing so much distress in my body that I had it removed. I have never been so uncomfortable in my life. And that's nothing against the expander. It's against the biomechanics of my body.
It puts a stressor into your system that couldn't handle, and the change that was imposing was not moving your dura and fascia and your nervous system into a proper homeostasis. And when body is not getting to homeostasis, symptoms persist. And if you're not focused on killing the symptoms, and what would be explain what symptoms you had, because a lot of people say, well, how did you feel? How did you know? Well, what are the symptoms you were having that told you this is not the right therapy for me?
I had chronic tension from my head right down to my tailbone, and I thought that it was due to misalignment and asymmetry in my body. So, there's a common belief out there, and there's a lot of literature that suggests that correcting the occlusion corrects the whole body. And that can be true. But what I found out is it's not always true. And if you think correcting the cranium and the occlusion is the end all and be all solution, you'll waste a lot of time if you're not that patient. And I wasn't that patient. I thought that the Marpe appliance would give me more mobility in my cranial bones to create a change in symmetry. And once I changed the symmetry, all my symptoms would go away. So I had it installed to mobilize the cranial bones. And yes, it will mobilize the cranial bones, but the thing is, those cranial bones are connected to the dura, and if your dura is tight, you're in trouble because you're going to push against an already tight dura, and if that happens, you're playing Russian roulette with your health. That could be deadly.
And you mentioned from the beginning of your journey when you said the whiplash injury that was the pivotal point in your health deterioration, was one of the main anchors of dura is between upper cervicals 1, 2, and 3, the base of the skull. And you mentioned when we are doing any changes in the structure of the mouth, a dural tissue that connects the mouth to the rest of the skull, to the temporal bones, that's where TMJ is, it connected to the base of the skull and those 3 important vertebrae. And a lot of our neurology and a lot of our vitality is in that area. It's a very sensitive area, that neural bundle. So if that dural tissue gets jammed and moved out of distortion, that can create a lot of symptomatology with the functionality of blood returning from the brain, draining the lymphatics from the brain, removing toxicity from the brain, and the functionality of the spinal fluid, which is a vital piece of our health. Circulating this spinal fluid around the brain, which Dr. Craig, in one of our episodes, is our SOT chiropractor, explained why the movement of the pump between your pelvis and cranium is important to move the spinal fluid. So at this point, you know that this intervention in particular not only is not giving you what you need, which I'm not sure why you needed it, but you had symptoms and had it removed. On to the next. You've had quite a bit of experimenting. And again, it's as a doctor, I'm just exhausted listening to this. And first time I met you on a Zoom call, I just couldn't believe my 2 ears. And you've practically known everybody that I have met around the world in their expertise. And I'm thinking, by now you should have been feeling better. So we met in February of 2023. Oh no, this year, 2024.
Yeah, 2024.
And at that point, you did have some appliance in your mouth still. You heard me on another podcast. Just tell us a little bit about that, because now you know that you need to find dentists. Dentists need to be a part of this. And sort of is not, your health is pivoting around your mouth, and it's not just your straight teeth. You don't need straight teeth because your teeth have definitely relapsed, changed their position. You no longer have the presentation of what we know as post-orthodontics. Tell me a little bit about that, Steve, and our audience that are listening.
So I watched the podcast probably, I'm not sure what month it was. I met you in February.
Yep.
Wow, time flies when your life's a nightmare, doesn't it?
Yeah.
That's a joke, by the way. Yeah, I watched the podcast because I was looking into craniodontics or chirodontics.
Yep.
Chirodontics. I was looking at chirodontics because I was wondering how the relationship of the pelvis to the cranium affects your health. And I wanted to know if there was anything I was missing. And I found your podcast with a chiropractor from North Carolina. And I thought, okay, there's answers here that I need to... I need to find more answers, but the answers might exist in this space, this whole chirodontic kind of pelvis SOT world, where there's an SOT chiropractor and there's a dentist, and they can balance the relationship between your pelvis and your occlusion. Because I knew that was probably most of my problem. There was something off between the relationship of my skull bones and my pelvis. Mm-hmm. And I needed to find answers. So, and I found your podcast or his podcast with you, and I thought, okay, that's it. I have to try this, and I have to try and find maybe people close to me who know the same thing as you know, and as the chiropractors know. And I couldn't find anyone that knew almost anything. Especially chiropractors, they didn't know anything about cranial adjusting, which is kind of sad because from my experience, cranial adjusting is very powerful. And if you can't adjust the cranium then, and spinal adjustments don't hold, then where do you go? Anyway, I couldn't find the resources I needed in Europe. So I came out here and I met Dr. Craig, the SOT chiropractor, and he checked Now, Dr. Craig's different than most chiropractors I've ever met. In fact, he's different than every chiropractor I've ever met. And in the sense that Dr. Craig has a very comprehensive way of testing the body and testing the dural system and whether you have torque in the system. So if you get traumatized, it can lead to a torqued dura, and it can affect the way you walk, move, breathe, because it's neurological tension.
Yeah.
And Dr. Craig is a very comprehensive way of testing whether you do have underlying dural torque. And I got adjusted by him, and I regained pelvic stability in one day. So my left SI joint was unstable, and I regained it in one day after one adjustment. But the key is, it wasn't a blind adjustment. It was an adjustment after a series of comprehensive tests, which is the key, because if you can't test it, then you're doing it blind. It has to be tested. Everything has to be tested, and everything can be tested in my experience.
And that's amazing, because I remember the first time I met you on the Zoom call, you told me that you're the first dentist that probably has looked at my cranium and my pelvis in the same shot. And that's why I don't practice without Dr. Craig. And that's been one of the best, more joyful part of my practice as a cranial airway center dentist, because he showed to me how TMJ is not an isolated treatment outside of the body. And I asked you to just move out here, because I knew if I'm ever going to have a shot at getting your mouth in alignment with your cranium, the base has to be proper. And that report really helps the audience to hear, why do we need to get things in check? I'm not denying that and you've had this, you've had upper cervical adjustment. That was the first powerful adjustment you've had. But if that worked, then why are we still here? And with the same token, that it doesn't take long for the body to be so out of alignment and so much outside of health and homeostasis. It only takes the proper splinter to be removed so that the body can wind itself back into health. Because what I'm seeing here is, although everything you've experienced has been great, but they've all been a piece of the puzzle. And the puzzle has been building itself. And if you're biased in solving a puzzle, we're basically jamming pieces together without the big picture. And I realized after watching your records, which was pretty profound, is that nobody has ever dared to see your borders and corners. That's the first thing we did. It's just, I had to come out here and have three of us look at you, three professionals, a good PT movement specialist group that I work with. Dr. Craig, obviously, he's probably one of the best SOTs I've ever worked with, and he's good at his craft, and he's great at, addressing the pelvis instability and spine. And I knew that there's something that I need to do with your mouth, and I definitely knew that the appliance therapy can work. So it was about a month into it, and a lot of trial and error, and we found out where your body really wants your neck to be, and how you're swallowing, and when your jaw comes together affects all of it. So was it like 4 months ago we got you in treatment, I believe? It was March or April?
Yeah, 3 months ago, I think.
Yep. And you officially went into Lightwire DNA therapy with me, with the supervision of Dr. Craig and a great physical therapy we worked with together. And I to this day remember when that appliance hit your mouth. And that's really just where I feel the joy to know. And if there's a dentist out there hearing this is one of the sentences I want to quote from you, that you said, what a time to be alive. And in honesty, Stephen, what a time to be a dentist for me. Yeah. And I think that the terms and the educations, we all have those initials after our name limiting us. And I never believed that. And I had the inherent belief right after dental school that everything they taught me in dental school and all the other courses I take are telling me how to fix the problem of the last generation dentist. And a question I've had from day one, what if I didn't have those problems to solve? What would I be doing? Like, I wouldn't be able to pay my bills if I didn't have those amalgams to remove and cracked teeth. And it's just a symptom management. So I very quickly figured that we're just chasing the dots, fixing teeth, not knowing why they break, why body is destroying the teeth. And the bigger the picture got, the less I see the teeth. And the teeth became the victims. And throughout the journey, I haven't really been focused on your teeth. But the fact is, you've had the treatment, and I would really like it if you can talk from the experience. Again, it's nothing guided. I really would like to know the good, bad, and the ugly, because maybe there's somebody out there and said, well, that treatment didn't work for me, and that treatment didn't work for me. You could sit down here and you're an encyclopedia of all the treatments could or could not work. And I don't think it's really the treatment as the order it's applied and for what purpose that may or may not work. And any treatment can work if it's in the right order, if it's in coherent and in alignment with the body, right? So tell us about how things have been different or not different in the last 4 months, because that really can just show us. And also, I'd like to hear the report. You just come back. So give us some report back here, Stephen.
So we need to go back to when I first came to Colorado. I had to go through a lot of diagnostic tests. Even before I came to Colorado, I sent you a lot of imaging, CBCT, cone beam CT. And this is probably the most important part of my journey, was sending off those images, because you were able to interpret those images and discover airway alignment patterns, cranial alignment patterns, postural patterns that are way more in depth than just testing someone on a table. You can see these findings in real time on imaging. So the postural pattern that I was in had a corresponding effect to my airway, upper airway and lower airway. It had a corresponding effect with my sphenoid bone, my temporal bones, my septum, my vomer, all of that. My dura inside my head, because we could see the connection points. So I must stress the importance of diagnostics when it comes to reverse engineering your patterns. Because if you're stuck in a pattern and you need to reverse engineer it, then you need to know what you're reverse engineering. You need to know where things are in space. Imaging helps with that, but it's very hard to find someone, and I don't think there's anyone else outside of this institute that can analyze postural patterns via airway imaging. And for me, that was a profound corner that I turned, and I was able to understand why things are going on and what I needed to correct. So first of all, you analyzed all my imaging. Then I made a plan to come out here. And then I went through a lot of diagnostic tests with the chiropractor, with you, and with a physical therapist. So we had to look at things from a dental standpoint, a global standpoint, and a dural meningeal standpoint. And only then were we able to place a unilateral block in the correct side to take me out of the pattern that I was in and relax my body.
Yes. And I could not, the first time I reviewed everything with you, I couldn't help but to notice you had a pen that was, you put in between the right side of your mouth. And I said, if that's what your brain tells me, then why would we ever support the other side? And that was my question to you. And he said, well, that's what they told me because that's my body pattern. And neurology speaks, but you're an engineer. And for those folks that are having a hard time following here, I see things as simple as a black and white when it comes to the orthopedics. But when it comes to neurology, it's a whole other story. Think about a car. We have 2 tires in the front and 2 tires in the back. And there's an axial that connects the front and the back. And there is this air that suspends this car. Now, if one side, let's say rear passenger side, the tires have low air, the tire, and then they're out of alignment. In a weight bearing, when the car goes into motion in a 4th gear, you see that the steering wheel is shaking. You see that the car is trying to keep straight alignment, because that's what we need to do in gait posture. And if the air tires, the pressure, the alignments are off, first of all, the tires get worn. That's why when I look at teeth and I see grinding and heavy wear facets and those wear patterns, which most dentists see it and they prescribe night guards, and it doesn't help, right? The fact is, teeth are the other end, or the front tires, where the pelvis and feet are on the other back end tires. And alignment of the front and back matters, and the spine is that chassis, right, in the middle of the car. And that's pretty much where Dr. Craig comes in, giving us that full alignment. And the sensory information from all tires in weight bearing in full cycle going into the 4th gear matters, because for the car to sustain that without shaking, needs to have balance in the cars, the air. And the air in our sinuses, the air in our chest cavity, and our pelvic floor all needs to be in motion, compressing one side, decompressing another in as we walk. And we don't look at humans that way. Breathing, walking, we just take it for granted. And I look at children with their feet that are stuck in the shoes and they have no idea how to reference the ground properly. The floors are not natural. The sensation of the ground, the different toys that we put them in, the bouncers. We kept talking about loading the spine at the wrong time, where they're still trying to get the top and bottom oriented. all contribute to the pattern you mentioned, just like that car. Like imagine if you put that car on the track without aligning the tires, the engine is going to burn out. So that's you. Like you had symptomatology after symptomatology. You turned 30 years old. Happy birthday, by the way.
Thank you.
And you've had, since you were 21 years old, almost a decade, you've been chasing and trying to get yourself into alignment. And you've got a ton of gift. You're a talented person. And I know you personally, and I know you in my professional world. I have had several conversations with you trying to decode you. And that's been really fun because I learn more from patients. And that's why I started this podcast, Stephen, to bring the truth to people. And I want that to come from the similar source because I can sit down here and talk all science, but you lived it as a patient and you had to learn more than I did to understand how your body works, to find the right people you can entrust with your health. And I'm so grateful that I happen to be a part of your journey, our path crossed, because it's just been as much fun and a learning experience for me as it's been healing for you. And so glad that the device is doing what it's supposed to do. I'm seeing a lot of changes. I can't wait to get some records and just sort of see them in real time. But again, I cannot thank you enough for sharing your experience, for coming out here and putting some information out there. I'm sure somebody out there is going to hear this and say, that's me. And if that's the case, look no further. Use this podcast, our YouTube channel, reach out. There's help. And at some point, hopefully I can share that experience and another success story with the audience. So that's it. Thank you everyone for tuning in. Stay healthy.